Hello students. Today's video lecture is on pneumonia. Pneumonia is the inflammation of the lungs, usually caused by an infection that can range from mild to a severe that you have to go to the hospital. It happens when an infection causes the alveoli in your lungs to fill with fluid or pus that can make it hard for you to breathe in enough oxygen to reach your bloodstream. It can affect one or both lungs, and pneumonia in both of your lungs is called bilateral or double pneumonia. Now let's discuss about the types of pneumonia. There are three main types of pneumonia, which is community acquired pneumonia, hospital acquired pneumonia, and aspiration pneumonia. Number one is community acquired pneumonia. When you get pneumonia outside of a healthcare facility, it's called community acquired pneumonia, and the causes are bacteria, virus, and fungi. Bacteria infection with Streptococcus pneumoniae, also called pneumococcal. In viral pneumonia, viruses that cause the common cold, the influenza, COVID-19, and respiratory syncytial. And in fungi like histoplasma and pneumocystis are uncommon causes of pneumonia. People with compromised immune systems are most at risk of getting pneumonia from a fungus. Now, the second type of pneumonia is hospital acquired pneumonia. You can get hospital acquired pneumonia while in a hospital or healthcare facility for another illness or procedures. Hospital acquired pneumonia is usually more serious than community acquired pneumonia because it's often used by antibiotic resistant bacteria like methicillin resistant Staphylococcus aureus. This means hospital acquired pneumonia can make you sicker and be harder to treat. The third type is aspiration pneumonia. Aspiration is when solid food, liquids, vomit go down your trachea, which is also called windpipe, into your lungs. If you cannot cough these up, your lungs can get infected. Now let's talk about the symptoms of pneumonia. The signs and symptoms of pneumonia vary from mild to severe depending on factors such as the type of germ causing the infection and your age and overall health. The symptoms of pneumonia are cough that produces green, yellow, or bloody mucus, fever, pale of the skin, sputum cough, chest pain, headache, and rapid pulse, rapid breathing, shaking chill, shortness of breath, and etc. Now, the risk factors. Pneumonia can affect anyone, but the two age groups at our highest risk. Number one, children who are 2 years older or younger, and second is people who are age 65 or older. And other risk factors are like chronic illness. You are more likely to get pneumonia if you have asthma, chronic obstructive pulmonary disease, or heart diseases, lung diseases, and etc. Third one is weakened immune system. People who have HIV, AIDS, who have had an organ transplant, or who receive chemotherapy or long term steroids are at risk. Fourth one is cigarette smoking. Smoking damages your body's natural defenses against the bacteria and viruses that cause pneumonia. Now, the preventions of pneumonia are get vaccinated. Vaccines are available to prevent some types of pneumonia and the flu. Talk with your doctor about getting these shots. The vaccination guidelines have changed over time, so make sure to review your vaccination status with your doctors, even if you recall previously receiving a pneumonia vaccine. Second is don't smoke. Smoking damages your lung and natural defenses against respiratory infections. Practice good hygiene. To protect yourself against respiratory infection that sometimes leads to pneumonia, wash your hands regularly or use an alcohol based sanitizers. And fourth one is keep immune system strong. Get enough sleep, exercise regularly, and eat a healthy diet. Now, diagnosis. Pneumonia can be diagnosed through various tests like blood tests, pulse oximetry, chest x-ray, and sputum tests. Blood tests are used to confirm an infection and to try to identify the types of organs causing the infection. However, precise identification is not always possible. Chest X-ray helps to diagnose pneumonia and determine the extent and location of the infection. However, it cannot tell your doctor what kind of germ is causing the pneumonia. Now, oximetry. Pulse oximetry measures the oxygen level in your blood, and pneumonia can prevent your lungs from moving enough oxygen into your bloodstream. And the sputum test, a sample of fluid from your lungs, for example, sputum, is taken after a deep cough and analyzed to help pinpoint the cause of the infection. Now, the treatment of pneumonia. Treatment for pneumonia involves curing the infection and preventing complications. People who have community acquired pneumonia usually can be treated at home with medications. Although most symptoms ease in a few days or weeks, the feeling of tiredness can persist for a month or more. Specific treatment depends on the type and severity of your pneumonia, your age, and your overall health. The options include medications like antibiotics to treat bacterial pneumonia, antifungal medications can treat pneumonia caused by fungal infections, and antiviral medications usually is not treated with medication and go away. And oxygen therapy. If you are not getting enough oxygen, doctor may give you extra oxygen through a tube in your nose or a mask on your fluid. And IV fluids. Fluids delivered directly to your vein uh, to treat or prevent dehydration. Draining of fluids. Like if you have a lot of fluid between your lungs and chest wall, a doctor may drain it. This is done with a catheter or surgery.